KST has completely revolutionized how I practice. I felt that I was practicing on the earth before, and now I'm practicing in the universe. That's what it feels like. That's how different. So it changes how I look at a patient, and the biggest way is that instead of me following my protocol, doctor-centered protocol, I am patient-centered, following the patient's body. So that resonates with me personally because my office is a patient-centered office. So it's all about the patient. And so this is completely congruent with how I was running my office, but now the adjustment follows that same philosophy. And it's like a combination lock. If you can have all the right numbers, but if you don't have the proper sequence, you're never going to open up that lock. And that is the best way for me to explain it. And so it's exciting every day. It's a joy to go to my office. I can't wait to go in. I can't wait to practice. And I get to support and partner with my patients and try to empower them and inspire them by what their body is saying to me. So sometimes I tell them I'm like a translator, basically. They may have whatever conditions they have or symptoms it's certainly important, but I'm not following their symptoms. I'm following what their body is telling me to do. So, they could say that they have a knee problem, but I could be working on their cranium the whole time and they walk out saying, wow, I think my knee problem is gone. And I didn't even touch their knee. And, KST practitioners have stories like that, millions of stories like that, literally. The OD rules my life. I mean, my kids will say, check your hands, and they'll look at me like, well, just check your hands. Yeah, like, Mom, my leg's hurting. Well, check with your hands. Like, well, why is it? And I'm like, well, and they're looking at me like I somehow have every answer to everything.
I'm glad my mom never knew the OD.
Oh my goodness, it's amazing. But they're right. They're right. I can check in, obviously, with anyone and help them. So I got adjusted. The first time I got adjusted by him, he was lecturing in Connecticut on vaccines, and then the very end, he was well, I'm doing this technique, kind of. Remember that whole thing?
Yeah.
Well, I'm kind of doing this new thing, totally, not making a big deal about it anyway. And so my mom was there. Her knees had been hurting. She'd had hip replacements and whatever. And so she's like, well, I'm definitely getting adjusted by him. And I was like, all right, I'll get adjusted. And so he adjusted her. Her knees stopped hurting and have never hurt again. Okay, and never. And so I used to adjust her activator, and the pain would go away for a couple of weeks, up to about a month, and then, and so we felt like, well, at least it goes away and we know how to handle it, right? Gone. She's never had pain in her knees again. That was, 2008 or something. And then I got adjusted by him, and what it felt like was my whole core was on fire, and my extremities went cold, super cold. And I was like, now he's adjusted me subsequent times, numerous times, and that's never happened again. Mm-hmm. But
he reconnected you,
totally reconnected me. Mm-hmm. And I was like, wow, I have been able to help patients get to the core of what's really going on with them in a way that I never was able to before, because I'm following what their body wants and needs instead of what my brain is thinking about. And my brain, although fabulous, is not as fabulous as the innate wisdom that each individual has in their body.